Hello, my name is Jonathan Nisanoff. I am an orthopedic surgeon in San Diego, California. I have been performing extracorporeal shockwave treatment for the past 5 years, and I will be discussing the indications and treatment of common orthopedic problems that would benefit from shockwave therapy. In 1991, High Medical Technologies of Switzerland developed and clinically tested the first extracorporeal shockwave device especially designed for orthopedic use. The FDA first approved extracorporeal shockwave treatment for chronic proximal plantar fasciitis in 2000, followed by lateral epicondylitis in 2003. This non-invasive procedure delivers high-energy shockwaves, a form of acoustical energy, to the affected area, thereby promoting revascularization and osteogenesis. This has gained acceptance among practitioners to treat a variety of orthopedic disorders, including Achilles tendonitis, non-union fractures, plantar tendonitis, and shoulder calcifications. While the FDA has not issued formal contraindications, physicians should exercise judgment in considering the following patients: anyone with a pacemaker, anyone on anticoagulant therapy or that has had a history of bleeding problems, pregnant women, and children. Because the high-energy extracorporeal shockwave treatment device has not been tested on subjects who have the following conditions, the safety and effectiveness of extracorporeal shockwave treatment has not been established for patients with the following conditions: tarsal tunnel syndrome or other nerve entrapment disorders, diabetic neuropathy, fractures of the foot or ankle, significant peripheral vascular disease such as atherosclerosis, skeletally immature patients, pregnancy, severe osteoarthritis, rheumatoid arthritis, osteoporosis, metabolic disorders, malignancies, Paget's disease, osteomyelitis, and systemic infection. Electromagnetic compatibility has not been determined in the use of extracorporeal shockwave treatment for patients with cardiac pacemakers, patients with a history of current or recent drug therapy that interferes with tissue healing, such as immunosuppressive agents or long-term corticosteroids, should be carefully evaluated prior to extracorporeal shockwave treatment. Certain precautions should be taken. Patients with bleeding disorders or taking medications that may prolong clotting time may be at risk for bleeding following extracorporeal shockwave treatment. Anesthesia should be administered prior to this procedure. The risk of hearing impairment should be reduced from the loud noise of the extracorporeal shockwave treatment machine by providing hearing protection for persons in the treatment room, including the patient. Extracorporeal shockwave treatment should be performed by a physician trained and experienced in the care of patients with orthopedic disorders who has completed a training course in the use of extracorporeal shockwave treatment. Hopefully, this video has given you additional knowledge of this new form of non-invasive therapy for orthopedic conditions, which should help your patients and your practice.